Number 1. A big team of people is needed for the operation to go ahead. The orthopedic surgeon, anesthetist, theater nurses, and others, porters, administration clerks, as well as equipment and beds. Within the hospital, there are 3 operating theaters for orthopedics out of about 24 in total. And Groote Schuur Hospital only has 40 beds for the care of these patients. That is not a lot. Number 2. With over 4,000 healthcare facilities and just under 40,000 doctors, we have a ratio of roughly 1 doctor to 4,000 patients in this country. I need not say more, but I will. Number 3. Our burden of disease, including trauma, which incorporates interpersonal violence and motor vehicle crashes, non-communicable disease, which incorporates obesity, as well as the natural process of aging, and communicable disease, which incorporates the high burden of tuberculosis and HIV, puts a lot of pressure on the orthopedic service already. And number 4, it costs roughly 20,000 Rand per operation. This is an amount that can be covered by the public service depending on your need, but on top of that, there are also the costs to you as the patient. Time off of work or away from family, time spent in recovery, not to mention transportation and daily upkeep. So, I know that I had said there were 4 common reasons, but here's a 5th one, because this is orthopedics, therefore doing the most is warranted. Statistics show that people who have already been on the list and have had their operation have had to wait just under 400 days before their procedure, whereas people currently waiting on the list will have already spent this amount of time and more. This can be interpreted as an increasing trend in wait times, which in reality can mean anything between 6 months at best and a few years at worst. Although South Africans have generally lower risk profiles for surgery, the fact that we have few specialists, a strained hospital infrastructure, and low procedural volumes, among other things, means that we don't experience low risk profile advantages as much as we'd expect to. Clearly, there is a lot of work being done on the doctor's side, and still just not enough time.